The routes of medication administration refer to how the body absorbs these medications. Drug companies must state which routes of administration are safe and effective for each drug before final approval is given by the Food and Drug Administration. The route is important because the research on that medication has shown that that way of absorbing that medication is the most efficient and the route with least adverse effects. So it can be ineffective or harmful if the medication is given outside or different than the recommended route of administration. If I'm going to apply something to the skin or the eyes or the ears, this can be either a topical or a transdermal route. If it's topical, that's usually a localized therapeutic effect. Sometimes that does extend past the localized area. Whereas a transdermal route, which is also applied to the skin, that medication is tended to pass through the skin, to be completely absorbed through the skin and provide more of a systemic effect. Perhaps I have a localized rash and I'm going to use a local antihistamine to reduce my rash, my itchiness from a bug bite. Or I'm trying to quit smoking cigarettes and I'm applying a nicotine patch. The first one is an example of a topical route. This second one with nicotine is an example of a transdermal route. With the transdermal route, it's applied to the skin, but the therapeutic effect is not just felt at the site of administration. And the medication is released slowly over 1 or more days. The most common route for medication administration is oral, and this includes tablets, capsules, and liquids. It is the most easy and it is the most convenient way to give medications. These medications are absorbed partially in the stomach, but mostly in the small intestine. The abbreviation capital P, capital O, small p, capital O is Latin for per os, that is, through the mouth. There are some disadvantages to the oral route, and this is because some patients find pills and tablets and capsules difficult to swallow. If your patient is unconscious or if they're vomiting, they cannot use the oral route, and some medications are inactivated by the acid within the stomach. Another route are the sublingual and buccal routes. The sublingual route is simply underneath the tongue. The word sublingual means underneath the tongue. The medication is simply placed under the tongue, it dissolves, and it goes into the bloodstream faster than it would if it had to go into the stomach and then into the intestines. So it provides a faster therapeutic route than the oral route. Another one that uses the exact same advantage of circulation is the buccal route, but instead of going underneath the tongue, it goes in the cheek. You place the medication in the pocket between the cheek and the lower teeth. There's very few drugs that are administered by the buccal route, a few more that are given by the sublingual route. The more common one is sublingual nitroglycerin that is sometimes given by first responders for patients who are complaining of angina-type chest pain. The intranasal route is spraying the medication directly into the nasal cavity. You see these frequently with antihistamines used for hay fever. The inhalation route is when you inhale the drug like a gas, or it could be in a liquid form, or it could be a powder form. The liquid and powder form are particles that are so small that they essentially float on air, and that allows the person to breathe in those small liquid and solid particles. This means that these medications are absorbed in, through, and around the alveoli in the lungs. So this is an example of a metered dose inhaler. This is a way to get things like steroids or bronchodilators into a patient who's suffering from something like asthma or chronic obstructive pulmonary disease. Another route is through a tube that goes from the outside of the body into the stomach. Now that route can be either through the nose, through the mouth, or even through an opening in the stomach. And these are known as gastric tubes. Gastric tubes can be nasogastric, oral gastric, or percutaneous. It is easiest to give liquid medications through these tubes to patients who cannot take oral medications. Now earlier I mentioned a PEG tube. A PEG tube is a type of gastrostomy tube. You can also have a jejunostomy tube. Both of those refer to surgically placed tubes that go into either the stomach or the small intestine. And both of them can be used as routes to administer liquid medications. Another route are the intravaginal, the intravesical, and the rectal route. The intravaginal route is used to treat vaginal infections, and it consists of creams, ointments, suppositories, and contraceptive foams. The intravesical route is through a catheter into the bladder, and this may be like chemotherapy for bladder cancer. The rectal route is reserved for when a patient is vomiting or when a patient is unconscious. So it's medication that cannot be given through an injection, and the best, safest route is per PR or per rectum. The problem is the systemic absorption is unpredictable. Suppositories and enemas can be used to relieve constipation, and topically they can be used to treat hemorrhoids. Another route is the intradermal or subcutaneous route. In the intradermal route, a syringe is used to inject a liquid into the dermis, that is between the layers of the skin. They can be used for something like the TB test. The subcutaneous route is when I use a syringe and a needle to inject the drug into the subcutaneous tissue, that is the layer of tissue that is just below the skin. This route is used to administer insulin for diabetes. It's used to administer allergy shots, and it can be used for the anticoagulant heparin. The intramuscular route is the injection of a liquid drug into the belly of a muscle, the biggest part of a muscle. It is absorbed more quickly than in subcutaneous tissue due to the fact that there's more blood vessels in muscle than there is in subcutaneous tissue. However, the muscle must be large enough so as not to injure a nerve. And that means in adults, we're going to reserve that for the ventrogluteal, the deltoid, the dorsogluteal, and the vastus lateralis. This is abbreviated as IM or I.M. Another route is the intravenous route. This is an injection of a liquid drug directly into a vein via a syringe or via an IV set. This bypasses a step in the absorption from tissues or stomach, and this means that the therapeutic effect is immediate or within just a few moments, so normally going to take a long time. Now, this does require equipment and either a needle and or a flexible catheter to be put in the patient's arm. There's usually a bag of IV fluid. This helps to flush or to move the medication through the tubing into the patient's body. And the IV tube is either hung with a roller clamp to control its rate or a computerized IV pump that controls the rate or the amount of that solution that's getting to the patient. There are medications that require a continuous infusion. These are usually attached to a computerized infusion pump. These are medications that are injected into a larger bag, and that bag, which contains the medication, is slowly given to the patient through the infusion over time. This is known as an intravenous drip or an IV drip. Sometimes, on top of the continuous IV drip, a smaller dosage of medication will be given. Usually, this is something like an antibiotic that doesn't need to be given continuously, but really only needs to be given over a certain amount of time, usually 30 minutes to 2 to 4 hours. If that's the case, we'll be using an IV piggyback. These are usually pre-mixed, but sometimes not. And again, they usually last for less than 2 hours. And this is a diagram which shows the difference between a main IV and a piggyback IV. There is something called an IV push. This is when the whole amount of the medication needs to be injected in a short period of time. This is also known as a bolus. And in this case, the syringe and needle are actually put directly into the IV as close to the patient as possible. And then the entire amount of that syringe is given to the patient all at once. Another concept with IV is what's known as KVO, which means keep the vein open. And this is an infusion that's done at an extremely slow rate, just enough of a rate to keep clots from forming on the end of the IV catheter, and therefore keeping the IV patent or open. I can also administer medications via something called an endotracheal tube. An endotracheal tube is a plastic tube that is inserted into the trachea, and it is sealed in there with a soft balloon. Air can go in and out of that, and we use that for artificial ventilation. Medications can be given via that endotracheal tube in emergency situations, and they will be absorbed in the alveoli. It's useful if there's an emergency and there's no established IV access. One of the abbreviations that we remember is the abbreviation NAVAL, and this reminds us which medications are safest and most efficient to give via endotracheal route. It's naloxone, atropine, Valium, epinephrine, and lidocaine. I may want to give these medications directly into a joint. This is known as the intra-articular route. It is used to administer those medications directly into a joint. For instance, corticosteroids can be injected to decrease pain and inflammation around the knee or other joints, and they're usually used once every few weeks or months. The epidural route is used to administer drugs within the cerebral spinal fluid around the spinal cord. Dura is dura mater. So this is the outermost layer of membranes around the spinal cord. If I give a medication that produces anesthesia, regional spinal anesthesia can relieve pain during childbirth, or it can treat severe chronic pain.